Alright, so today the CNA Brady is going to give a partial bed bath on this resident here.
Hello, Mr. Brady. Today I'll be doing your partial bed bath.
So first she starts by just cleaning the face. Next, she's going to clean the arm, and the hand. Now she's just going to dry the arm and apply some lotion to the arm. Now she's just going to put it together. That's a partial bed bath.
Hi, I'm Nyaska and this is Louie, and we're going to be performing an occupied bed. Alright, hi Itzel, I'm Nyaska and this is Louie, and we're going to be making your bed, okay? Alright, so first we have to loosen these sheets so it's easier for us to make the bed.
Let's arrange the bed first.
that okay for you? Alright. So we have to make sure that the head of the bed is flat. So alright, it's flat. Now, can I take your pillow, please? Thank you. Now, as we untuck the sheets, we're just gonna be rolling it towards the middle, so it's easy for us to take out the sheets. But as we do this, we have to maintain the patient cover, or the resident. As we make the bed, we roll the sheets outwards so we don't contaminate ourselves. And as we do that, we place it in the dirty linen container. Now I'll be turning my resident towards my partner. All right, I'll be turning you in 3, okay? 1, 2, 3. As we make the bed, we align the sheet towards the top, towards the bottom, and then create a sailboat on the top. I am now rolling the sheets so it's underneath all the dirty linen, and it'll be easy for us to make the bed once we turn her my way. While performing this skill, we have to maintain good body mechanics so we don't injure ourselves while performing the skill. Now we're going to turn the resident towards me so my partner can finish making the other side of the bed. You're going to fill along? My partner will now perform the same skills I performed at the beginning.
flat.
Alright, now we're gonna lay you flat. And Alright, so I'm gonna just take this out. Now we're removing the sheet that was covering her as we place the clean linen. Hold it up. Now we're just gently tucking at the feet so she has enough room to move and she doesn't feel restrained by the sheets. Now I'm placing the sheet for the pillow. But to do this, I have to turn the sheet opposite or upside down, and just kind of like hug the pillow inside. All right, and so would you please raise your head?
Comfortable.
Now that we're done the skill, I'm placing a call light so she could, if in need of any help, she could just ring the bell, and it's easy access for her. She doesn't have to restrain. She's not, she can call as soon as possible. Just pull the actual cord, and then the light will just ring. And it will notify the charge nurses that she is in need of assistance. We'll now lower the bed to the lowest position, so if any circumstances she doesn't fall or hurt herself. All right, that's the lowest, and then the rails and now wash our hands. And this has been the skill of making an occupied bed.
Hi, my name is Donisha and this is Maria. We'll be doing a transfer from bed to wheelchair. Good morning, Maria. I'll be moving you from your bed to your wheelchair today. Is that okay with you?
You pull the curtain for privacy so the resident will feel comfortable.
And make sure the wheelchair is locked for safety measures.
Are you ready? This side of her is paralyzed. I'll be moving this side.
Using proper body mechanics, the resident and the CNA will move the resident in a comfortable position so they can move into the wheelchair. Before we move the resident, we make sure that the resident has their shoes on in case they step on anything or anything drags, their feet are protected. We use a gait belt to support the resident's back to get her in a wheelchair, and for the CNA as well, so she can have full body control of her top of her body.
On 3, I will be lifting you up. So sit you inside your wheelchair. 1, 2, 3.
The CNA makes sure her back is in the chair because of the fact that we don't want the resident to tilt over and fall out the wheelchair. At this time, we attach the wheels to the wheelchair so the resident will feel comfortable. And if we were to move her down the hallway or such, her legs would not drag. We make sure the wheelchair is still locked so the resident may not fall or roll the chair. And we put the call light within reach so when the resident needs something, she could just pull it and we come to her assistance. Then also, we wash her hands.
Hi, I'm Chastity and I'm performing denture repair. Alright, so first she's gonna start by lining the sink with the napkins, just in case the dentures fall, they won't get damaged. Now she's gonna carefully remove the dentures from the cup of water. Alright, now you're gonna rinse the dentures under cool water. After rinsing the dentures, you're gonna use a toothbrush and a little bit of toothpaste and just begin brushing the top. Now she's just brushing the teeth with the denture, just like you would brush normal teeth, making sure they're clean. Alright, so when she's finished brushing the teeth, now she's just going to rinse the teeth off and place them in the sink. And just replace your water in the container. She's going to place her dentures in clean water. And that's denture care.
We will be moving your patient from a chair to a wheelchair. First, the nurses will introduce themselves. Good morning, I'm Nurse Kim. I'm Nurse Nara. We'll be transferring from chair to wheelchair, okay? Is that okay with you? Nurse assistant will remove the brake. Footrest, sorry. Then she will put the brakes on the wheelchair. The nurse assistant will explain what she's doing to the patient, which is putting the belt around the waist. Okay, lift your arm up, please. Is that plain enough? Then she will lift her and over to the wheelchair. On the count of 3, I'm lift you up, and when you feel this behind your leg, you may snap. 1, 2, 3. When she is finished, she may remove the belt. Nurse assistant will add the and remove the brakes in the wheelchair. If you need anything, here's your bell to ring for us.
Today we are demonstrating ambulating the patient with assistance. This skill gives the patient a chance to get up and moving. To keep me from getting injured, I'm going to tell the patient what we are doing, and on 3, I'll stand her up with my knees against hers. As I stand her up, I hold onto the gait belt to help support her. I'll hold onto it as I walk her to keep her from falling. Can you please lift your arms up? Okay, good. Ready? 1, 2, 3.
And we're going to use the link today, move from your bed. Is that okay with you? Unless we're going to move from your bed.
You have to take the patient's blanket and move it all the way down to the bottom of their feet so you can get the lift sling underneath of them. Then you cross the patient's ankles so like you make it easier to move it. Then you put the sling underneath the patient and you turn them on their side and you make sure the sling cloth is up near their head so their head has support when you move. Then you roll the patient on his or her opposite side so you can grab the sling from the other side. Then once you have the cradle underneath the patient, you take the 2 bottom straps and you place it under the near leg and over the far leg. Then you lower the lid closer to the patient's torso, so it makes it easier to hook the straps. and make sure that the colors on opposite sides are corresponding with each other.
We're gonna lift your head up.
Then each nursing assistant needs to check, make sure they're on the same page. Then you begin to lift the patient up out of the bed.
We're gonna move now.
And then you pull the whole lift out, and one of the nursing assistants needs to stop the patient, just in case. Then you open the leg of the lift to make it easier to maneuver. Then once you're done, you close the legs of the lift, so you can put it back under the bed and let the patient back into bed. Then you lower the patient back into bed once you're done moving. And that's how you move the patient using a lift.
Okay, so today we're going to do a fire evacuation drill for our patient in case there is a danger in the building. And this procedure is for patients who are unable to move by themselves and need assistance. First, you roll their blankets down the bed and then tuck it. And then one nurse takes the feet and the other takes the head and rolls up each side. And then you confirm it with your partner. Are you ready? And then you swing them. And then you lift him up and swing him by the feet. And then you let his feet hit the ground. And you slide him out of bed using your thigh. Then you turn him, and then both nursing assistants grab him by the head and you pull them to safety.
Like, foot. Hi, Brianna. I'm Nurse Brianna. Hi, Nurse Brianna. I'm Brianna. I'm gonna provide your privacy. What's your mom? You? And if anything hurts, you can let me know. We'll go up, flexion, down, extension, up, flexion, down, extension, up, flexion, down, extension, and then to the leg, and go up again, flexion, down, extension, up, flexion, down, extension, up, flexion, down, extension, and then go to the side. Plantar flexion, dorsal flexion, plantar flexion, dorsal flexion, plantar flexion, dorsal flexion, and then back up to the arm. Abduction, Adduction. Abduction. Adduction. Abduction. No.
Okay, today we'll be showing you how to properly put on your PPE equipment and to remove. First, you start with your gown. And then you tie the neck. And then you tie the bottom part. And then you place your mask on. Then you place your goggles on. And then your gloves. And make sure the gloves is covering your white part, the sleeve. Now we will be showing you how to remove your PPE equipment. First, you start with your gloves. Then you remove your gown. Then your goggles. And your mask. And this helps us and the patient so we won't give each other germs and stuff like that.
And after you're done, you wash your hands